Good day, everyone. Today we will discuss about the digestive system using the human torso.
The human digestive system.
What is digestive system? The digestive system breaks down and absorbs nutrients from the food and liquid you consume. It breaks down food into nutrients such as carbohydrates, fats, and proteins. They can be absorbed into the bloodstream so the body can use them for energy, growth, and repair. Unused materials are discarded as wastes. Now, let's proceed to the discussion of the parts of the digestive system.
Mouth. The mouth is the beginning of the digestive tract. In fact, digestion starts before you even take a bite. Your salivary glands get active as you see and smell that pasta dish or warm bread. After you start eating, you chew your food into pieces that are more easily digested. Your saliva mixes with the food to begin to break it down into a form that your body can absorb and use.
Tongue. The tongue is a muscular organ in the mouth. The tongue is covered with moist pink tissue called mucosa. Tiny bumps called papillae gives the tongue its rough texture. Thousands of taste buds cover the surfaces of papillae. The tongue functions as digestive organ by facilitating the movement of food during mastication and assisting swallowing.
Pharynx. The pharynx, commonly called the throat, is a muscular, funnel-shaped passageway inside the body. It connects the mouth and nose to the esophagus. It carries air, food, and fluid down from the nose and mouth.
Esophagus, located in your throat near your trachea. The esophagus receives food from your mouth when you swallow. The epiglottis is a small flap that folds over your windpipe as you swallow to prevent you from choking. A series of muscular contractions within the esophagus called peristalsis delivers food to your stomach.
Stomach. The stomach is a hollow organ or container that holds food while it is being mixed with stomach enzymes. These enzymes continue the process of breaking down food into a usable form. Cells in the lining of your stomach secrete a strong acid and powerful enzymes that are responsible for the breakdown process. When the contents of the stomach are processed enough, they are released into the small intestine.
Small intestine. The small intestine is actually the longest segment of the gastrointestinal tract. The long, continuous pathway that foods travel through your digestive system. In the small intestine, food is broken down into liquids and most of its nutrients are absorbed. The waste is passed onto the large intestine.
Large intestine. The large intestine is the last part of the gastrointestinal tract, the long tube-like pathway that food travels through your digestive system. It follows from the small intestine and ends with the anal canal, where food waste leaves your body. The large intestine, also called as large bowel, is where food waste is formed into poop, stored, and finally excreted. It includes the colon, rectum, and anus. Sometimes colon is also used to describe the entire large intestine. Rectum. The rectum is a straight 8-inch chamber that connects the colon to the anus. The rectum's job is to receive the stool from the colon, let you know that there is a stool to be evacuated, and to hold the stool until evacuation happens. When anything gas or stool comes into the rectum, sensors send a message to the brain. The brain then decides if the rectal contents can be released or not.
Anus. The anus is the opening at the far end of the digestive tract through which stool leaves the body. The anus is formed partly from the surface layers of the body, including the skin, and partly from the intestine. The anus is lined with a continuation of external skin. A muscular ring keeps the anus closed until the person has a bowel movement.
Liver. The liver has many functions, but its main job within the digestive system is to process the nutrients absorbed from the small intestine. Bile from the liver secreted into the small intestine also plays an important role in digesting fat and some vitamins.
Gallbladder. Gallbladder is part of your digestive system. Its main function is to store bile. Bile helps your digestive system break down fats. Bile is a mixture of mainly cholesterol, bilirubin, and bile salts.
Pancreas. The pancreas secretes digestive enzymes into the duodenum that break down proteins, fats, and carbohydrates. The pancreas also makes insulin, passing it directly into the bloodstream. Insulin is the chief hormone in your body for metabolizing sugar.
Constipation. Constipation generally happens when you go poop, less frequently than you normally do. When you are constipated, your poop is often dry and hard, and it's difficult and painful for your poop to pass. Diarrhea. Diarrhea is when you have loose or watery poop. Diarrhea can cause by many things, including bacteria, but sometimes the cause is unknown. Heartburn. Although it has heart in its name, heartburn is actually a digestive issue. Heartburn is an uncomfortable burning feeling in your chest that can move up your neck and throat. It happens when acidic digestive juices from your stomach go back up your esophagus. Hemorrhoids. Hemorrhoids are swollen, enlarged veins that form inside and outside of your anus and rectum. They can be painful, uncomfortable, and cause rectal bleeding.
Ulcers. An ulcer is a sore that develops on the lining of the esophagus, stomach, or small intestine. The most common causes of ulcers are infection with a bacterium called Helicobacter pylori and a long-term use of anti-inflammatory drugs such as ibuprofen. Gallstones. Gallstones are small pieces of solid material formed from digestive fluid that form in your gallbladder, a small organ under your liver. Chronic acid reflux. Chronic acid reflux is a condition in which acid-containing contents in your stomach frequently leak back up into your esophagus. Irritable bowel syndrome. IBS is a condition in which your colon muscle contracts more or less often than normal. People with IBS experience excessive gas, abdominal pain, and cramps. Lactose intolerance. People with lactose intolerance are unable to digest lactose, the sugar primarily found in milk and dairy products.
Colorectal cancer is a disease in which cells in the colon or rectum grow out of control. Sometimes it is called colon cancer for short. The colon is the large intestine or large bowel. The rectum is the passageway that connects the colon to the anus. Most colorectal cancers start as a growth of the inner lining of the colon or rectum. These growths are called polyps. Sometimes a polyps can change into cancer over time, usually many years. But not all polyps become cancer. The chance of a polyp turning into cancer depends on the type of polyp it is.